Okay, so this is case study 2, and yesterday we went over number 1. Remember, normal blood pressure, at least how it has been taken in the past, is 120/80, and it's measured in millimeters of mercury. The higher number is a measure of systolic pressure, so the pressure when the heart is contracting, when the ventricles are contracting. The second number, the lower number, is a measure of the diastolic pressure, which is the pressure when the heart relaxes. We talked about hypertension, that was number 2, and that's basically chronically elevated blood pressure, which greatly increases your risk of heart disease. So it may be because there's plaque buildup, it might be because you have a higher amount of plasma proteins floating around in your blood. There's lots of different reasons for increased blood pressure, but this is chronically increased blood pressure. So chronically elevated blood pressure, which isn't good for your heart. Number 3, we took a look at the slides, and there were slides showing some factors that contribute to blood pressure. Okay, so this was the slide we looked at for blood pressure. The instrument that they actually use to measure it is called a sphygmomanometer. They don't really say that very often. They usually say blood pressure cuff, but it's kind of a cool word. Sphygmomanometer. This is how it's done. We talked about it. We might try and do it as a little activity, but basically they put the cuff around your arm. They increase the pressure in the cuff in order to close off the vessel. Oh, I guess I could make this big screen. In order to close off the vessel, so they'll increase it to above what would normally be the higher reading. So if normal higher reading is a 120 millimeters of mercury, then they would increase it so it's above that. So here it's showing 150. And then they slowly release the pressure while they're listening to, using a stethoscope, listening for the heartbeat. As soon as it starts to beat, that's when they take the first measurement, and then the second measurement is taken whenever you can't hear the heart beating anymore. So that would be the diastolic pressure reading. Okay, so that's how they measure the blood pressure. Oh, this is all in the... If you watch the full video on blood pressure, that's all described in there anyway, so I won't go into that much more detail. But in number 3, it does ask for possible causes for increased blood pressure for this 65-year-old patient. So we talked about this as well. Diet high in salt, which causes you to retain water, that increases your blood volume and therefore more pressure against the walls and harder for your heart to pump it. A diet high in cholesterol, which causes clogging of arteries, makes it harder for the blood to be pushed through your vessels because it narrows your vessel diameter. Regular use of artificial stimulants, that basically they're called stimulants because they increase your heart rate and they constrict your blood vessels. So things like caffeine, which is in coffee, nicotine, which is in cigarettes, and other things. Alcohol can also influence your heart rate and your blood vessels. Heredity is another major factor. Lack of exercise, obesity, and age. So your blood pressure often tends to increase as you age, depending on how you take care of yourself too. The next question, we also had answered this one, but I'll put it on here anyway in case you missed it at the end of class. So, describe 2 of the more common ways in which a heart can fail. Okay, so this is number 4. Either the left ventricle is too weak to squeeze, which is so-called systolic failure, or so the left ventricle in the second case is too thick and stiff to relax, so it's having a hard time relaxing, and that's diastolic failure. The second one, when the heart's having a hard time relaxing, that's what tends to be more common, and it's usually due to years of higher blood pressure, so hypertension. Number 5. How is congestive heart failure different from a heart attack? Congestive heart failure is a condition in which the heart cannot pump enough blood to meet the needs of the body. It occurs when the heart has been maybe damaged or weakened, or it's just from overuse when there's high blood pressure, maybe certain kinds of infections, things like that. Usually it tends to occur gradually, but it may occur more quickly if a lot of the heart muscle is damaged at once. A heart attack, on the other hand, occurs when blood flow to the heart muscle is interrupted. So it tends to be more sudden. It tends to be caused maybe by a blockage or a clot in a vessel that supplies blood to the heart, or severe clogging of the arteries that are supplying the heart. So when you've probably heard of people having things like a bypass or a triple bypass, and that's because they may have had a heart attack because the blood hasn't been able to reach their heart muscle. So when the heart is deprived of oxygen, then it causes damage to the heart itself, even death of some of the heart tissue. Number 6. Explain how nitroglycerin can temporarily relieve the effects of congestive heart failure. So basically nitroglycerin works by dilating the arteries, and when it dilates the arteries that are leading from the heart, carrying blood to the tissues, then it makes them wider and it makes it easier to pump the blood through. So it's decreasing the blood pressure, so it's a lot easier for the heart to pump out excess fluid and excess blood that's building up in it. It also dilates the arteries that are supplying the heart itself, so it dilates the coronary arteries, is what they're called, and so that means that we can get more blood to the heart, which is struggling to do its work. So it's important to make sure we get enough blood and oxygen and nutrients to it. Number 7. How were A, sepsis, and B, pneumonia ruled out as a cause for the patient's symptoms? For sepsis, that's A, his blood pressure was high, 205 over 100, and sepsis lowers the blood pressure, so because of the high blood pressure they ruled out sepsis as a cause for his symptoms. For B, his lungs were wheezing but not rumbling, so because the chest didn't thud whenever they were tapping on it, there was no real sign of pus buildup, which is a sign of pneumonia. Okay, number 8. What is cardiac output? What two things determine cardiac output? Think what times what gives you cardiac output. So we're going to have a look here at cardiac output. Okay, so cardiac output, cardiac refers to the heart, output means what it puts out of it. So basically, cardiac output is the amount of blood pumped out of the heart in 1 minute. So that is the volume, if you're talking units, it would be volume of blood per minute. If you're thinking of a formula that you could use, the cardiac output is basically the stroke volume times their pulse or heart rate. If you're math-minded, you probably want to see how the units work. So the stroke volume is basically how much volume of blood can be pumped out of the heart in one beat. So that would be one stroke of the heart, if you think of it like that. How much volume can be pumped out in one heartbeat. Okay, so it's volume per beat, and you multiply that by their pulse or heart rate, which is the number of beats in a minute, and the beats cancel out, leaving you with the volume that's pumped out per minute. Some factors that can affect cardiac output. I don't think that was asked in here, but we'll talk about it anyway. No, we won't talk about it anyway. If you want to, if you want to watch the full thing on cardiac output, you can watch it in the lesson that I already did, because I don't want to have too much overlap. So this was just to answer the question, give you a visual to answer the question from the case study, but you really should go and watch the blood pressure video lesson, okay, because then it ties it all together. Okay, number 9. How do the kidneys respond to cardiac output which is too low? In other words, as the heart is failing. So, basically, as the cardiac output falls, the kidneys try to make up for the reduced blood flow by trying to kind of get blood pressure back up. So they trigger a few steps that cause your body to retain fluid. So remember, the job of the kidneys, if you don't know, the job of your kidneys is to basically filter your blood, and in the process, the waste that we get rid of, we call urine. Okay, so because they're dealing with our blood and kind of help to regulate the fluid level of our blood, when your heart is starting to fail, then they can be triggered to not let as much water go out in the urine. Instead, it'll keep that water in order to keep your blood pressure up. Number 10. What is edema, and how does congestive heart failure cause buildup of fluid or swelling in the tissues? Edema means swelling caused by fluid in your body tissues. So basically, as cardiac output falls, so if your heart is failing, the kidneys try to make up for the reduced flow by retaining body fluid and boosting blood pressure. But when the pressure in the heart rises too much, blood backs up into the vessels nearby. Okay, so blood and whatever can be forced out at the capillary level will be, well, not red blood cells, but the fluid, the plasma. A lot of that fluid is going to be forced back out into the capillary area, and it causes tissue swelling. Okay, and that's what we call edema. So eventually the fluid is going to leak out in the capillaries around your lungs, or around the heart itself. You'd find which tissues tend to swell or show signs of fluid buildup is also part of the question. If the right side of the heart is also weakened, then it starts to cause fluid to be backed up and pushed out of capillaries and in the region of your body tissue. So your legs and your feet and even your abdomen will swell with fluid. So basically, if you were listing them, the things that tend to swell the most in cases of congestive heart failure would be lungs, because they are really close to the heart. You'd see some swelling in the area around the heart. Your legs, your abdomen. Of course, with your legs, your feet would be swelling too. And that's it for case study 2. So, we'll stop. We'll stop there for case study 2.